Imagine this. You're 3 months into your nursing career. A patient grabs your hand and whispers, "Please don't let me suffer anymore. Just let me go." But their family just authorized another round of aggressive treatment. Your shift started 6 hours ago. This decision, you have 60 seconds. Welcome to the invisible war zone of nursing, where the battles aren't fought with scalpels, but with conscience. Today, I'm pulling back the curtain on the ethical nightmares that new nurses face every single shift, the ones nobody talks about in nursing school. Here's what they don't tell you in orientation. Within your first year, you'll face more moral conflicts than most people encounter in a lifetime. A 2023 study found that 89% of new nurses experience moral distress within their first 6 months. But here's the kicker. Only 12% report feeling prepared to handle it. Picture day one on the floor. You're excited, terrified, ready to save lives. Then you meet Mr. Patterson, 67, end-stage cancer. His body is shutting down, but his daughter, who hasn't visited in 5 years, suddenly appears demanding everything be done. Meanwhile, Mr. Patterson's living will says the opposite. Who do you listen to? The absent family member who legally can make decisions? Or the document that represents the patient's autonomous wishes? You have a full patient load, and this decision needs to happen now. Well, let me hit you with 4 scenarios that will keep you up at night. Dilemma 1. The medication miracle. A senior nurse tells you to give a patient medication through a route not prescribed by the doctor because it works better this way. And I've done it 1,000 times. She's been there 20 years. You've been there 20 days. Do you follow orders from experience or protocol? If you refuse, you're labeled difficult. If you comply and something goes wrong, your license is gone. Dilemma 2. The staffing nightmare. Your unit is supposed to have 6 nurses. Tonight, there are 3. You're assigned 8 patients instead of 4. You know this is unsafe. You know someone could die from a missed symptom. But if you refuse the assignment, you could be charged with patient abandonment. Stay and risk harm. Leave and lose your career. Choose. Dilemma 3. The family secret. A 16-year-old girl comes in after a suicide attempt. She confides in you that her father has been abusing her. That's why she did it. She begs you not to tell anyone. She's terrified. But legally, you're a mandated reporter. Your silence could mean more abuse. Your report could mean she never trusts a healthcare provider again, or worse, escalation at home before intervention arrives. Dilemma 4. The resource rationing. 2 patients need the last ICU bed. One is 34, a mother of 3, overdose victim, second time this month. The other is 76, pillar of the community, stroke victim, first emergency ever. Both will likely die without intensive care. Someone has to decide. And guess what? Your opinion matters in this conversation. How do you assign value to a human life? Here's what nobody prepares you for. These dilemmas don't stay at the hospital. New nurses report something called moral injury. It's beyond stress. It's a wound to your core identity. You became a nurse to help people, but now you're caught between hospital policy, legal liability, family demands, and your patient's actual needs. Sarah, a new grad I interviewed, told me about the night she had to perform CPR on a 92-year-old dementia patient with stage 4 cancer. Breaking ribs, causing pain, 0 chance of meaningful recovery, because the family couldn't let go. She did her job. She followed the code status, and she went home and vomited from moral disgust. The real mind blow? This happens every single shift. And here's the part that should terrify healthcare administrators. 60% of nurses who leave the profession within 2 years cite moral distress as the primary reason. not the hours, not the pay. The fact that they're forced to participate in care that violates their ethical core. If you're not a nurse, you might think this doesn't affect you. Wrong. Every single person watching this will be a patient someday. And the nurse holding your hand when you're most vulnerable, they're navigating these impossible choices while trying to advocate for you. When nurses are morally depleted, patient care suffers. Studies show direct correlation between nursing moral distress and increased patient mortality rates, medication errors, and hospital-acquired infections. We're not just burning out nurses, we're breaking the backbone of healthcare. But here's a glimmer of hope. Hospitals that implement ethics committees accessible 24/7, that provide moral distress debriefing, that empower nurses to speak up without retaliation. They retain staff 3 times longer and have significantly better patient outcomes. So what do we do? If you're a new nurse watching this, know that what you're feeling is real. Moral distress is not weakness. It's evidence you still care. Seek out ethics committees. Find mentors who will discuss these dilemmas openly. Document everything. And please, please don't suffer in silence. If you're an experienced nurse, create space for these conversations. New nurses need permission to question, to struggle, to admit when something feels wrong. If you're a patient or family member, understand that your nurse is fighting battles you can't see to give you the best care possible, often against systems that make that incredibly difficult. And if you're a healthcare administrator, invest in ethical infrastructure or watch your best people walk away. The truth is, nursing isn't just a job. It's a daily exercise in applied philosophy with life or death stakes. And our newest nurses are walking into this arena with virtually no armor. It's time we change that.